Hello, my name is Summer Stewart. I'm the Assistant Athletic Trainer at Drury University. We have a 19-year-old football player that presents to the athletic training room with a fever that he has had for the past 2 to 3 days. He also states that his face has begun to swell within the past few hours. After talking with him, you were able to find out that he has had difficulty chewing and overall feels like he got run over by a truck, which he has elaborated into headache, muscle soreness, and fatigue. Immediately, I think of things that could be going on, such as he could have encephalitis, he could have influenza, he could have a salivary gland infection, he could have a ear infection, he could also have mumps, he could have a tooth problem, or he could be having an allergic reaction. Based on these different diagnoses, my plan of action would be to get him checked out by either the health center on campus or the team physician. If I was thinking that it was a tooth problem, then I'm going to send him to the dentist. If I'm thinking it's an allergic reaction or the flu, I may have him wait a day or two, but by having him wait, I could also infect other athletes and his teammates. I also think that he may have an allergic reaction. So other things that I will need to ask him is if, he is up to date on his shots, if he has changed any of his food or soap or anything, if he has traveled anywhere, or if he has been around someone that has been sick, had the mumps, had strep, had meningitis, or anything like that. I decided to send him to our doctor, who completed a medical history and exam. The doctor sent him for a culture of his saliva and confirmed that he had mumps. His roommate is also a football player, so I want to reduce the spread of this. I am going to have the athlete that has been confirmed with the mumps to quarantine in his room, making sure that if he needs to come out to use the restroom or food, that he is wearing a mask, that he is cleaning all surfaces that he may have touched. I am also going to have his roommate get tested if he starts to have any symptoms. I'm going to quarantine them both at least for a couple of weeks, sorry. Other precautions that I need to take, I need to make sure that I am wiping down the training room, educating the other athletes and coaches on the team. I will provide a handout so that they can pass this along to any parents who might be worried. I'm going to also notify the school, the health department. I'm going to make sure that any of the athletes, if they feel like they are getting sick, that we get them tested, or if they are feeling uncomfortable about the situation, or if their parents are, then we will send them to get tested. The advice that I give the athlete with the mumps is to have him rest in his room, to stay away from everyone, to make sure he is taking care of himself with proper nutrition, good hygiene, hand washing, wearing a mask if he needs to go out for the restroom or to get food in his apartment. I'm going to instruct him not to leave his apartment or his room at all, and talk to him about having someone deliver food to him. I'm going to advise him that he can take ibuprofen or Tylenol as needed for pain. I'm going to also talk with all parents, administration, and talk to them basically about suspending the season for a couple weeks so that we can make sure that no one else is sick and that we don't end up giving it to any other athletes. I'm also going to do the handout and talk with them about the risk or the vaccine and how that most people are covered, but there is an off chance that you can still contract the mumps without it. Now, let's change this from mumps to the coronavirus. I would go about educating the athletes and parents the same way by, providing them handouts and talking to them about steps and stuff like that. I also wanted to ease all their fears that they have about the stuff that they see on TV, stuff that they hear in the news, because there's a lot of advice out there. I would talk to them about if the athletes are feeling sick or anything, to please let me know, because we have a rapid test here at the school that we can give to them, and if it happens to come back negative and they are still having symptoms a few days later, then we can do a PCR test. I would also have them practice good hygiene, making sure they're not going out and about and putting themselves at risk in the public. Make sure they're staying 6 feet apart, make sure they're social distancing, and also making sure when they come to the training room or to the practices that they are hand sanitizing and hand washing, not sharing water bottles, making sure they're taking their temperatures, making sure that they are practicing good nutrition, and overall just keeping everything clean and not trying to travel to places that they are not needing to.